Okay, let's do our quick review of heart failure. I had a student ask me about some confusion they were having with how heart failure differed from AFib or some of these other cardiac disorders. Heart failure we discuss a lot alongside those other disorders because any of the cardiac disorders, one of the complications is that they develop heart failure. So you will see this alongside valve disorders, dysrhythmias. And so that's why it is very important. So we're always wanting to try to prevent and control heart failure. So it's really kind of a complication of the other disorders. Someone can have an MI, and because the heart's not functioning well, they can go into heart failure. They can have a dysrhythmia. And again, because it's not pumping well and they have reduced cardiac output, they can go into heart failure. Or they can have a valve disorder, an inflammatory disorder, and end up going into heart failure. So you're always wanting to assess your patients for the signs of heart failure with any of those cardiac disorders so that you can prevent that. This slide here is just a good comparison of what's going on with heart failure. What's your priority assessment? So you want to make sure that you have some of these kind of items on your concept map that you have. Watch, in addition to these, watch your vital signs. Look for increased respiratory rate. This will happen because they're trying to improve oxygenation, and increased heart rate that you might see as well. Also watch for any hypotension that you may see, or again, they could have a hypertensive crisis going on. Look for increased respiratory effort, edema, things that you might hear in your subjective assessment, such as do they have to sleep upright? What type of shortness of breath are they having with exertion? Any nocturia, any chest pain? And again, if this is a chronic heart failure patient, they're doing those daily weights. So you want to be listening if they've had any rapid shifts in their weight, and then their overall appearance. If they have any anxiety, that can be, again, a symptom of poor perfusion, paleness, cyanosis, any of that. And so what will you see in addition to these with your, labs? Again, BNP. That BNP is critical with looking at those fluid levels. So elevated BNP is indicative of heart failure. We'll see chest x-ray, arterial blood gases, you might see enlarged heart with chest x-ray, or if they do echocardiogram, ejection fraction might be reduced with this as well. And so what are some of our priority kind of interventions? We'll be administering oxygen, monitoring vital signs, ECG, O2 sat, urine output, daily weights, and then you'll be administering those cardiotonic or ionotropic drugs. This is where we talked about DIG, diuretics. We talked about, the loop diuretics. And so all of those are important. And then each of those kind of priority interventions are going to be things that you will be teaching your patients. And so on, your education or discharge, these are things you can kind of remember, MODS, meds, activity, weight, diet, and symptoms are going to be things that are important. And so trying to prevent complications is going to be vital. And so some of the priority kind of complications that we're trying to prevent, or actual complications that you'll see, are going to be respiratory distress, and this is due to that pulmonary edema or pleural effusions, cardiac dysrhythmias. They might develop a type of shock called cardiogenic shock. You might see skin breakdown because of the edema. They, again, because the heart's not pumping regularly, they can be at risk for thrombus formation. They might end up with an enlarged liver, and again, that's because of fluid and ineffective heart, renal failure, and cardiopulmonary failure. And so here are some of the things, again, safety-wise, that we want to be monitoring for that can help us look for those complications. In your box on nursing implications, you want to be looking for over/under hydration. These patients might need fluid restrictions. Again, depending on the diuretic that they're on, we may need to be assessing potassium levels. So we'll for sure be monitoring the, electrolytes on our lab work. And then even giving, because of the edema, some comfort measures. So elevating the legs. They might have compression stockings like Ted hose. We might need to be educating on low sodium diet, or potassium in the diet. And then if they're having anxiety due to the lack of perfusion, we want to be giving that nice, calm environment and reassurance. Some of those meds that you want to be looking at in your book will be digoxin, know the signs of dig toxicity and when to hold. The patient teaching with furosemide as a diuretic. And again, those beta blockers, calcium channel blockers. I posted a YouTube video. It wasn't made by me on cardiac meds, but it did a quick overview, or you can also look at your farm book as well. And then I think we've covered our education well. If you think there's a mnemonic that you can teach your patients called FACES. The F is for fatigue, limitation of activities, the A. C is cough and congestion. E is edema. And that final S is shortness of breath, like on exertion. They might be on home O2, so they might need education on that as well. Daily weights, we've talked about, low sodium diet, potassium in the diet. So hopefully that's just a quick overview. Feel free to email me if you need more information, and keep up the great work you're doing with your studies.